Hello, and welcome to our very first presentation of the Adagio Health Better Health Outcomes Speaker Series. I'm BJ Leber, President and CEO of Adagio Health. Like so many nonprofit organizations, Adagio Health has had to figure out how to keep moving forward during the COVID-19 pandemic. This speaker series is enabling us to safely continue important conversations about women's health, health equity, and racial health disparities in this virtual space. Our 4 speaker series presentations will cover food insecurity, the Black maternal health crisis, behavioral health, and racial health disparities. These are continuations of conversations that were part of our Transforming Women's Health Symposiums in 2018 and 2019. Now, these discussions have taken on new importance in light of the pandemic and its continued impact on vulnerable populations. Today, our focus is on food insecurity. It's certainly not a new problem in this country or this region by any stretch, but recent news reports on long lines of people and cars at food distribution sites all over the country have driven home that the need for food and resources has grown dramatically over the last year. We have 2 amazing women joining us today, and I'll introduce them to you shortly. But first, we would like to present this brief look at how Adagio Health is working to close the gap on food insecurity. It is my pleasure to introduce our Director of Nutrition Services, Brittany Zwergel, as she explains more.
My name is Brittany Zwergel. I'm the Director of Nutrition Services at Adagio Health. Within our department, we have the WIC program that is administered in 5 counties: Armstrong, Beaver, Butler, Indiana, and Lawrence. Additionally, we have a SNAP education program that we call Power Up, and that's administered through 16 counties in Western Pennsylvania. COVID-19 really helped to show a spotlight on the need for more food assistance programs for a lot of our families. And again, working families were also faced with this with the pandemic. So fortunately, Adagio Health was able to partner with some great organizations to really help meet the need of those families. Adagio Health has really found a champion of a partner with the Greater Pittsburgh Community Food Bank. We work with so many members of their team. They are wonderful. They have helped us to really start all of our food insecurity work. Adagio was fortunate enough in 2018 to open a food cupboard or a food pantry in our Indiana medical and WIC offices. Since that time, we are looking at opening up 4 additional food pantries in this upcoming couple of weeks, the next month. So it's very exciting for us to be able to offer that on-site assistance. We also were able to expand our food insecurity project within our WIC and medical offices. We were able to provide food boxes of shelf-stable food. We were fortunate enough to not put any limitations on who was available to receive those boxes. Anyone that walked into Adagio Health stores were provided the opportunity to take one of those boxes home with them. We've had some of our participants break down in tears or just express how thankful they were for that added food box. It really helped to bridge the gap for a lot of our families. Many people might be embarrassed about expressing the need to find food resources, or they might be uncomfortable sharing that they are food insecure. So having these food cupboards in a space where our participants are already there. They're already there to receive medical care or WIC appointments. They trust our staff, they know our staff, they have a relationship. So this past year with COVID-19, it really has challenged us in the nutrition services department. We had to really figure out how to still deliver the WIC program to our participants, but do that in a safe manner.
My experience with Adagio Health WIC has been amazing. Like, just from the get-go, everyone has been super helpful. My first intake interview or whatever, they were fantastic and really just encouraging and supportive. My favorite thing for sure has definitely been the breastfeeding support group that is coming through the WIC office. There's like a Zoom class that we have been a part of. I've been a part of like every month, and I honestly think that has been a huge reason why I have stuck with breastfeeding this long. And it's just been really great. The extra food every month has been really helpful, and I've received like some food boxes from them too. Not only has that been a blessing for my family, I've actually been able to use the food from that a lot to like help with the kids I serve with. So that has been just a huge blessing as well. And it's really just been an encouragement and extra support for our family. If you were like struggling or in need of support, I think WIC is an amazing resource because they have just been a blessing. I can't imagine I'm married and my husband is super supportive. I can't imagine any moms out there doing it on their own. I know it's just been a huge support. So for anyone like wondering like how am I going to do it, I know WIC has definitely helped. It's cool to like walk in with like several bags of groceries and be like, this was all provided because of WIC.
I want to acknowledge Brittany and the nutrition services team and the entire Adagio Health team for all of the tremendous work that they have done during the pandemic. We have two amazing women joining us today. Lisa, as I believe most of you know, if not all of you, is the president and CEO of the Greater Pittsburgh Community Food Bank, and she leads that organization in distributing enough food for approximately 40 million meals annually. She also serves, I'm proud to say, on the board here at Adagio Health. She is the chair of Feeding Pennsylvania and serves on many other boards and committees in our community. Lisa was recently recognized by Pittsburgh Magazine as Pittsburgher of the Year, and we're so glad to have her with us. Jane Clements-Smith is the executive director of Feeding Pennsylvania. That is our state association of Feeding America food banks. She also serves on the state's Mass Care Feeding Task Force through the Pennsylvania Department of Human Resources. In 2017, Jane was appointed by the PA Secretary of Agriculture to serve on the Emergency Food Assistance Advisory Council, and she is active in Governor Tom Wolf's Food Security Partnership. Jane, we are so glad to have you here today also.
Thank you so much for having me today. My name is Jane Clements-Smith, and I am the Executive Director of Feeding Pennsylvania. We are the Partner State Association of Feeding America Food Banks, and I'm here today joining Lisa Scales, the CEO of the Greater Pittsburgh Community Food Bank as well. And we're going to do this presentation together about solving hunger today and ending hunger tomorrow. So just to tell you a little bit about Feeding Pennsylvania, we, as I said, are the state association. There are 9 Feeding America food banks in Pennsylvania, and we cover all 67 counties. Food banks are large warehouses, large distribution spaces. And the reason we're able to serve so many people in Pennsylvania is because we rely on partner agencies. There are nearly 3,000 of those across the state, and these are pantries, soup kitchens, shelters of the sort. So our partners really distribute about 80% of the pounds that we get out to people in need. They are the ones who are client facing and run a lot of those programs. But our food banks also do programs like backpack programs. We have school pantries that we run, and we've been working a lot with colleges and universities as well to make sure we get the food out to the people who need it most. And this gives you a little visual about a food bank versus a food pantry. Like I said, I think there's a little misconception. The food bank to the left, like I said, is a large distribution center, and we move tractor trailer loads across the state to agencies, which are like a food pantry over here on the right, where a client would typically be able to come through and choose the food that they'd like to take. To talk about food insecurity, I think it's important to look at the poverty guidelines. So we run at 150% of poverty. So if you are a single person, in order to get state or federal food, you'd need to make less than $19,000, about $19,000 a year. So for a family of four, it's under $40,000 a year. So believe it or not, in Pennsylvania, we were serving about 1.5 million Pennsylvanians before COVID-19. And then we'll talk a little bit about what happened after March of last year. So in 2018, 10.9% of the people in Pennsylvania, including about 500,000 children, were facing hunger. And then when March hit and the COVID-19 pandemic hit Pennsylvania, we saw an incredible jump in hunger, mostly because a lot of jobs were completely eliminated overnight due to the COVID-19 restrictions. And the interesting and maybe challenging part to that was that many of the people who were suddenly facing very tight income and maybe food insecure had never needed those kind of resources before. So our food banks worked very quickly to be able to react to the COVID-19 crisis by making a very large investment in our warehouse infrastructure, in our volunteer services, and in the food that we were able to distribute. Feeding Pennsylvania does a lot when it comes to agricultural partnerships. We actually administer the Pennsylvania Ag Surplus System through our Department of Agriculture, and we have a whole position that is dedicated to just working with farmers and processors across Pennsylvania. This funding that we get through the state helps us to work with farmers to cover the costs like harvesting excess produce. We've taken tanker loads of milk and processed it into cheese. We've been able to work with egg producers to get eggs for as little as 13 cents a dozen just by paying for the cartons. So it really helps us get a variety of fresh Pennsylvania products into the hands of those who need it the most. But it's also a win-win for our agriculture industry because we're able to reimburse farmers and processors for the cost for getting it into a packaging that we can use. Feeding Pennsylvania also runs a produce cooperative. It's called the MARC, the Mid-Atlantic Regional Co-op. The Greater Pittsburgh Community Food Bank is a member of our co-op, but it actually serves food banks from Virginia all the way up to New England. There are 26 members, and these are 40,000-pound truckloads of produce. The idea being that food banks wanted to be able to provide more fresh produce, more variety of produce, and low cost produce, but also looking at the lifespan of that produce. So this has been a very successful program. We were doing about 30 million pounds of produce each year. And then during COVID-19, we actually shifted to a boxed produce program before the USDA actually even came out with their program. And it's been so successful that we think we'll continue that probably for the next several years. Fill a glass with hope. Pennsylvania is a dairy state, and dairy is our #1 agricultural industry. And so we found in 2014-15 that milk was one of the most requested items in the charitable food network, yet it's rarely donated. And if it is, it's close to expiration. And so Greater Pittsburgh Community Food Bank and the Central Pennsylvania Food Bank piloted the Fill a Glass with Hope program, where we raise money so that our food banks can purchase milk at a reduced price from a local dairy. It was so successful that it went statewide. It went statewide in 2016, and we've been able to procure and distribute more than 14 million servings of fresh milk. And you'll see there, we've had NFL players join us annually for our big fundraiser event. That's First Lady Frances Wolf. We've had the governor. It really is a one-of-a-kind program, and we've been proud to work with other states to help them implement a program like this. Feeding Pennsylvania also has a strong advocacy program. We advocate on the federal level for several of the commodity programs that help us get more food into the charitable food network. This was so important during the COVID-19 crisis to be able to get waivers, to get more food to more people in need. And then we are very blessed in Pennsylvania to have 2 state programs. I already talked about the Ag Surplus program, but we also have a state food purchase program, so a state version of the federal TFAP program. And so we work together statewide with a committee of food bank members to be able to talk to legislators about the importance of funding these programs. And then I talked here, you'll see me there at the left next to Claire, the CEO of Feeding America, with our President Joe Biden. We were really excited on MLK Day. We were able to host him at Philabundance in Philadelphia, and he came and packed those boxes that we talked about earlier. So it really does pay to have a lot of contacts within the government, and hopefully we're looking forward to a positive experience with the new USDA administration. So now I'm going to hand it off to Lisa Scales with the Greater Pittsburgh Community Food Bank.
Thanks so much, Jane. I really appreciate that. So as Jane mentioned, we're one of 9 Feeding America food banks that are in the Feeding Pennsylvania network, and we're one of 200 food banks that's part of the Feeding America network. So if you can advance the slide, Jane. So our mission is to feed people in need and mobilize our community to eliminate hunger. And we have a service area of 11 counties in southwestern Pennsylvania. And on average, our network of 600 partner organizations serves 110,000 people each and every month. Next. And so as a member of Feeding America, we're all assigned a service area. Some of us have a 1 county service area, such as the Westmoreland County Food Bank. You'll see there in the center of our service area. They are a full member of Feeding America, one of the 200 food banks. And so we don't serve Westmoreland County directly, but we serve the 11 counties here in southwestern Pennsylvania. We go up to Lawrence County and over to Somerset and Indiana County. And what you can see on this map is the significant impact that COVID has had on food insecurity rates. So just pre-COVID, looking from pre-COVID to now, we've seen a 42% increase in the number of people who are food insecure, and so troubling that 57% increase in the number of children who are food insecure. That's 113,000 children in our 11 county service area, or 1 in 4 children are now food insecure. Next. So in terms of the food, I put our food in 3 buckets: donated food, and that's what most people, when they think of food banks, they think of donated food, and certainly that is the majority of the food that we receive. It's almost 50% of the food, and the vast majority of that is fresh produce. But we also get support from the federal government with food that they donate through the Government Commodities Program, and that is the biggest way the federal government supports food banks. Not only here locally or across the state, but nationally, is with the acquisition and distribution, delivery of food to food banks around the country. And then we will also purchase items that are not normally donated. So we wanted to be a one-stop shop back in the 1980s when we opened our doors before Costco or Sam's Club. We wanted to ensure that we had a good variety of items on our inventory. Next. So I did mention produce makes up a large portion of that donated food. Overall, when we look at the number of pounds that our food bank distributes every year, 32% is fresh produce. And frankly, our goal is by 2025 that 50% of what we distribute will be fresh produce. And that's so important to us. We're really focused on the health and wellness of the people we serve. And when we look at just the donated product alone, 75% of product that's donated to our food bank is fresh food. I know there's people may think of us from the food bank of the 80s or the 90s when fresh food was a small percentage, and I still see that out there on social media and in other venues that food banks are not able to handle fresh food or fresh produce, and that's just not the case anymore. So that fresh produce is so important for us to have. It's nutritious, it's expensive at the grocery store, and it's not available in many communities. Next. So there are a number of other programs that we that we conduct in partnership with two important ones in partnership with the federal government. The Child and Adult Care Food Program, that is for our after-school programs to provide nutritious meals or snacks to kids when they're during the school year during an after-school program. Next. And the other important program for us is the Summer Food Service Program. This program is open to kids regardless of income, and it is an underutilized program, and it really provides those essential meals in the summer when kids are not in school and not able to get school breakfast or school lunch. And we've had a focus on adding sites throughout our 11 county service area, especially in the rural counties. And then several years ago, we started to sponsor sites in Allegheny County. And we put a significant amount of effort into ensuring the kids have enough nutritious food to eat during those summer months. Next. I talked a little bit about communities without fresh produce. There are a number of what's called food deserts, communities without grocery stores or farmers markets. And several years ago, we started the Green Grocer program, and we purchase, this is all purchased product that from local growers, from produce vendors, and then we have a mobile, basically a mobile truck that goes out and then sells that product. We can't sell and wouldn't sell donated food or government food, but this all purchased product, and we go into 11 communities that are food deserts in Allegheny County, and we have a weekly schedule where we offer those products at a low cost to people who live in those communities. And we do accept SNAP in addition to cash, SNAP formerly known as food stamps. Next. And I'll turn it over to Jane. We're going to talk more today about our focus both at Feeding America and at our food bank in terms of health and wellness. Jane?
Sure. Sorry about that. I had to unmute myself. Can you hear me okay? Lisa or anybody? Okay.
Yes.
Okay, great. Yes, so we're going to talk a little bit about health and wellness. So we know that through a lot of data that there is definitely a correlation between health and food security and food insecurity. And we know that we as food banks really felt that we should take a role in that. I think a lot of times in the history of food banking, people considered us the place where you get canned food, pasta, bread, and maybe cheese. But we really, as Lisa just talked about, have taken big steps to invest in and work through how we can play a bigger role in helping people live healthier lives. So we talked a lot about the fact that healthier food often is the more expensive food, and we wanted to be able to figure out how can we offer not only the food, but the education around how to prepare the food in ways that people would want to be able to eat it. And so, okay, sorry here. Oops, I'm sorry. And actually, Lisa, these are some of the stuff you were going to cover here. But Lisa, do you want to talk about this one? Because this is actually about Pittsburgh.
Yeah, sure. I'll be happy to. So we. On you.
No, you're not. Lisa, are you there?
Lisa.
Oh, okay. I didn't think I was on. Sorry about that. So yes, so in terms of the health of the folks who we serve here in southwestern Pennsylvania, we've done a number of studies, had some surveys, and we really looked at what is the quality of people's health, especially in terms of those diet-related diseases like diabetes, COPD, hypertension. And as you can see from this slide, that we have a significant number of households we serve that have a high number of people who have diabetes, have hypertension, or have to often choose between paying for their healthcare costs, paying for their medication, or paying for food. Next. So when we really look at, and we take diabetes in particular, and we take a look at that cycle, what happens when people are food insecure, and and they don't have consistent access to nutritious food, and they may go several days without eating, and then they may binge eat, and so it really causes them to, it impacts their health, especially in terms of diabetes, and they progress through that cycle, and it becomes an ongoing issue for them, really a chronic issue for them. And so what if we can do right now, where the typical intervention is after someone becomes diabetic, and what we want to do as food banks in our partnerships with healthcare providers, such as our partnership with the Greater Pittsburgh Community Food Bank with Adagio Health, is if we can intervene sooner before diabetes becomes chronic, we have that ability to improve people's health and wellness. Next.
And so out of all of this work that the food banks have been doing, I'll give credit to for several years, Feeding Pennsylvania partnered with the Pennsylvania Department of Health to create the Healthy Pantry Initiative. We, through this program, have a registered dietitian now on staff, and we've been able to provide funding to several of our Feeding America food banks to hire nutrition educators in each of the member food banks that work with pantries to take a look at the inventory that they are bringing in and how they are displaying that food, the ways that they're talking to clients about some of their health needs and health risks and what some of the dietary restrictions might be. And then also taking a look at kind of what people know when they come in and then what they know when they leave. We're also able to do a lot when it comes to, and this gives you a little idea, I'm not going to read through all of them, but we're able to meet one-on-one. Now, this doesn't happen as much now with COVID-19, but we're looking at virtual ways to do cooking demonstrations. We've partnered with organizations to be able to do recipe cards, videos, and then, like I said, working one-on-one with pantry executive directors or head lead volunteers to take a look at the fact, just like a grocery store, how are you marketing the food that you're offering, and can we put healthy food right at eye level, and can we have little display cards that kind of show you things that are low sodium, things that are low cholesterol, things that are heart healthy, and whatnot. So it's been a very successful program. As part of that grant, we did require the food banks to each come up with their own wellness policies, and Feeding Pennsylvania as well came up with a wellness policy. And Lisa's going to talk a little bit about the Greater Pittsburgh Community Food Bank and their policy, which has been in effect since 2019.
Thank you for that, Jane. Yes, so again, when we did some surveys and we found a significant number of the households we serve have someone who has diet-related disease, it became important to us as a food bank to establish a wellness policy and really focus on what is the quality of the food that we're providing. We really think of ourselves as a public health organization. Next. So if we look at that, and this is hard, it's not easy as a food bank to turn down food, especially donated food. And so we had to make the difficult decision, or not so difficult decision, frankly, when we're really focused on people's health and wellness, to say, we will not take soda pop. We will not take any items that sugar is listed as the first ingredient. We will really, we will use our nutrition rating system to look at the amount of sugar, fat, and salt in the products when we're purchasing products through our wholesale buying program. And that's really allowed us to dramatically improve the quality, the nutritional quality of the food that's on our inventory that our agencies can choose from. Next. So in terms of nutrition education, I'd like to start by saying that our food bank has been a leader in the Feeding America network in terms of nutrition education and a focus on nutrition. You know, when food banks opened their doors in the mid to late 70s, we were incorporated in 1980. A lot of the product, as Jane mentioned earlier, is canned goods, boxed meals. We had a lot of cookies, crackers, snack food, not necessarily the most nutritious. But we hired a registered dietitian in either 1990 or 1991. So early on, we wanted to have a focus on bringing in more nutritious food but pairing that access to food with nutrition education, food education. So we started cooking demos. We have recipe cards, we have a nutrition newsletter. So I just want to very briefly kind of take you through some of our efforts in terms of nutrition and food education. Next. So you'll see these are actually salmon steaks that are cooking. We actually started our cooking demonstrations in the late 90s when we had received a tractor trailer load of frozen salmon steaks from Alaska. And we realized that many of the people we serve may not know how to prepare that, may have never had salmon before. And so we wanted to make sure that as we get food out to the community and into people's homes, that it just doesn't sit in their freezer, doesn't sit in their refrigerator, but they actually eat it. So we started cooking demonstrations knowing that people are used to preparing some of the same recipes and meals all the time. And we wanted to make sure that people saw how easy it was to prepare, say, a salmon steak. And we wanted to offer them a taste test. So if they tasted it and they liked it, they were more likely to actually eat the food that we were providing. Next. So in our Choosing Healthy Options program, we wanted as a value add to our network, our agencies, when they go online and they are making decisions about what food to order off of our inventory, we have a rating system. Basic 1, 2, 3, 1 choose frequently, 3 choose sparingly, and we rate again the amount of sugar, fat, and salt in the products on our inventory, and it helps our agencies better understand the nutritional value of the food that's on our inventory. Next. And then recipe cards. They really we've transformed them from kind of black type on white index cards to now having photos, having icons as to whether the recipe is heart healthy or not. And we also include, if you had to buy the ingredients at the grocery store, what the cost would be. So again, trying to provide as much information as we can to our agents or to the agencies, to the individual, especially around those items that we may get. We would frequently get lentils and other beans or items from the federal government that people may not be familiar with or used to cooking with. So if we get in a tractor trailer load of lentils, we'll have offer a number of lentil recipes for people to use. Next. And then we have a nutrition newsletter. These newsletters right now are going into our senior boxes. So it's nutritious food for income eligible seniors, and there's recipes in there. There's other cooking tips. There's other information on leading an active lifestyle. Next. And then really excited about our partnerships and just want to commend Adagio Health, and they're such a great partner of ours in terms of working together to ensure people have consistent access to nutritious food. So we have our Thrive boxes. They're boxes of medically tailored food, nutritious food that's shelf stable, but we have those at Adagio offices. We have them in doctors' offices. And so if someone is screened for food insecurity and they are found to be food insecure, then right there in the moment, on that spot, the healthcare provider can hand the patient a box of nutritious food. We've also started to locate food pantries or healthy food centers in hospitals, and we continue to grow that program as well. Next. I'll turn over to Jane. We want to end by talking some about the response that food banks across the state have done in response to the pandemic. Jane?
Yes, so we had talked a little bit earlier about this, but just to put it into perspective, our food banks typically on an annual year serve 2.2 million Pennsylvanians because people do cycle in and out of poverty. But in the first 3 months of the COVID-19 response, we served 5.5 million people. So it really was a huge effort by our food banks. And as I said, funding was just so incredibly needed because we were quickly within the first month or March of COVID, we were spending over $1 million a week just meeting the increase in need. So that's the PPE, the extra warehouse space to bring in volunteers, and then also all the extra food. Plus, and I talked earlier about the pantries where you typically got to walk around and do a choice model of picking out things you wanted. Well, in order to try to mitigate the spread of the COVID-19 virus, we moved to that boxed method. And so again, all of those things really do add up and cost a lot of money. A lot of the food banks had to take a look at the different ways to do drive-up distribution, so less hands-on. And Lisa's going to talk a little bit here because Greater Pittsburgh Community Food Bank really did an incredible job at meeting such an incredible increase in need and had a lot of media attention around it.
Thanks, Jane. And it really just the need exploded overnight, as you all know, in the middle of March, and we had to very quickly devise new ways to safely distribute food. We have a program called Produce to People that we serve 500 to 600 people in a couple hours, but people park and then they gather together, and we had to cancel all of those distributions. And so that was really the impetus for the drive-up distributions. We were looking for a safe way to get food out quickly to people in need, because again, just overnight, we started to get almost 100 people coming to our warehouse in need of food. Just they would show up unannounced. We started to get hundreds of phone calls from people who were recently unemployed and had not been connected to a pantry, looking for a pantry or a source for food. And then on our website, we have a Get Help button on our website and a pantry locator, and we started to get thousands of hits on our website for people, frankly, in desperate need of food. They were unemployed. They were facing an uncertain future, still are. And many of the people we're serving today, they've been without a job since March. So the drive-up distribution certainly received a lot of publicity, but I'm really proud of how our network, that 600 member network, many of those are food pantries, and they're run by volunteers who are senior citizens. And 94% of our pantries have stayed open throughout the pandemic. It's really the seniors saying, you know, we're here to serve our neighbors and we'll remain open. We have to figure out new ways of getting the food to our neighbors, but we're here for them. Next. So just some of the fun photos. I mean, it really is a team effort. We cannot do the drive-up distributions without the support of the community, especially the 40 to 50 volunteers it takes to run one of those distributions. It really is a team effort, and we still operate 11 drive-up distributions every month. Frankly, we're still operating in response to the pandemic pretty much the same way now as we did back in the spring. Next.
Yeah, I think it's important to note that even though a lot of people have returned to work, many have returned not to the same salary level that they were before. And there are still a lot of jobs, as we know, a lot of restrictions that have not returned. And our pantry network is still seeing an increase of 60% of the people we saw year over year. So while it sometimes feels like we're getting a little more back to normal, we really foresee this still being a big issue for us for at least the next 2 years as more people get vaccinated.
Well, that's right, Jane. And I'll say in particular, we've seen a spike in need again more recently. So in response to the pandemic, we added a life stabilization team to our program department. And within that team, we established a call center. And in July, we advertised we added 2 positions. We thought that having 2 people handling phone calls would be enough. And in the early fall, we were averaging about 70 phone calls a day. Well, right now we have 5 full-time people handling phone calls now. So we have 5 people handling phone calls. We're not sure that that's enough. We're now seeing over 100 phone calls a day from people in need of food and other critical services. So the need has definitely not diminished. So yes, and you'll see here, this really grabbed the national spotlight, the lines of cars and people in need of food assistance. And really, the pandemic has shown a spotlight on the disparities in society. It's important to remember that people were in line for food before the pandemic. That was not a new occurrence. It just became big national news because there were so many people now. But we do have to remember that there are many families that we serve, and the biggest change in who it is we're serving are people pre-pandemic was people who were employed but earning low wages. So there are many families who are struggling. They just don't have enough income. And now, of course, as Jane said, that need has increased so dramatically, and we anticipate at least this need will remain high 2 years, if not, frankly, much longer than that. Next. So in terms of what we've done, in addition to adding the call center, establishing the drive-up distributions, a few other ways that we've responded to the pandemic here in southwestern Pennsylvania is that we've added what we're calling non-traditional partners to our network. So of the 600 members in our network, we have added more than 135 organizations, and it's a new category for us. They're not a food pantry. They're providing boxes of food. They're organizations like Casa San Jose, the Latino Community Center, the Veterans Leadership Program that are providing other critical services, but people are coming to them and we're able to provide food also because they have that need. And it's really part of our drive to get food to where people are and when they need it, getting food closer to people by having it where they already are going to. Next. So, and then home delivery, right? That just makes sense, especially during a pandemic. Not an easy for a nonprofit to sustain a home delivery is not easy, but in late March, after a Sunday afternoon meeting to get this program up and running, by the following Friday, so in 5 days, we did our first 200 deliveries. And that's a program that we're offering in 3 of our counties, but we are looking at scaling that up so that we can offer doorstep delivery or home delivery in all 11 counties that we serve. Next. And then finally, very excited about one of our new innovative programs, which is we've installed, and you can see there the photo on the left, we've installed 40 refrigerated lockers at a pantry in Ambridge. This is really quite new, that actually we haven't even launched this yet, so I'm giving you a preview of it. We expect that those lockers will go live by having food in them in the next 2 weeks. But people will be able to order. The order will be placed in the refrigerated locker. Important for us that it's refrigerated, again, so we can include fresh produce. And there'll be a screen on each locker, and people can, or there'll be a screen on the system, and there'll be information on how people can access different services such as SNAP or food for children or where to go for a pantry. Next. So Jane, I'll turn it over to you in terms of how people can help.
People always ask this. We definitely are still doing volunteers. Your local pantries are definitely always need them, the food banks, and they're taking all kinds of precautions. So it is a safe thing to do now. Obviously, donating is great. We definitely can take the dollar much further than you going out and buying food and donating it to us because of the relationships we have on a state and national level. So funding is always appreciated. And then advocating, really as simple as calling your local legislator or even using your social media as a platform to get the word out about hunger and about the face of hunger. All of those things can be extremely helpful to our mission. So we'd like to thank you so much for having us. And I guess at this point, we'll open it up for any questions.
Thank you for sharing with us today. I certainly want to thank them. I want to thank them for the work that they do. I want to thank them for creating an awareness about the depth and breadth of the food insecurity problem, but also for leading organizations that are doing something about it and having an impact. So Jane and Lisa, I think we'll start with Jane for this one, and then we'll go to you, Lisa. The question is, how do you change operations to address needs of culturally diverse neighborhoods?
Okay, so actually, Lisa may be better at this, but I know on a state level, we meet as a food sourcing committee of various groups, always to look at addressing what kind of diversity we're offering as far as the sourcing of different food. And I know that there are a lot of advisory committees in each of the counties that do advise on that. As far as Healthy Pantry goes, we're also looking at beyond the food that we source, what are the different languages? And believe it or not, it's, I think we decided there's about 8 different languages that would actually be a priority for those recipe cards, and working on the funding to be able to get those moved around. But as far as food sourcing goes, I'm actually going to hand that to Lisa, because she as a food bank would probably be able to answer that a little bit more in depth than I could.
Yeah, thank you for that, Jane. We do reach out to the community and check in terms of what are the items that we have on our inventory. And as I mentioned, we have we do serve a diverse population. There's in a large immigrant population in the South Hills, a growing Latino community here in the Pittsburgh region, and so we do work closely with our partners and check in with them and identify what are those items that they need, and then we do go out and we source those as best we can. I will say that we are next week we're launching a large year-long community and stakeholder engagement initiative to more deeply understand the needs in the community, especially in communities of color, and really looking at the those communities and what the needs are of people. So really excited to be able to launch that and to ensure that we can provide culturally appropriate food to all of our neighbors.
And we have time for one more question. So we're going to start with Lisa for this one, and then we'll go to Jane, and then we'll say goodbye to everybody. We saw a new crisis unfold in Texas last week. Horrible. And there had to be tremendous spoiling of fresh food with the power outages on top of all of the other issues that those folks were dealing with. How do you even begin to mobilize a response to that type of crisis, and then layer on the fact that we're in the middle of a pandemic?
I tell you, I was on a call with my colleague, Eric Cooper, the CEO of the San Antonio Food Bank, and they had 2 storms. They like to say, the second one was pretty small for us. The first, they had 12 inches, but that was followed up by a second snowstorm of 5 inches. And that community and many of the communities in Texas were not prepared to handle that. And of course, we're without and continue to be without water, and many are still without electricity. And so it was a real challenge. Fortunately for the San Antonio area, the food bank there has a generator. They have a kitchen within their food bank, a commercial kitchen, and they were able to make thousands and thousands of meals. But they really, again, because of the work that food banks do in the community, they really reached out to volunteers, and it really was a very much kind of a phone tree and getting people who would come in their Jeeps and their pickup trucks in Texas and come to the food bank and help the food bank get food out to the community. I do know that at one of the hotels locally, they had about 1,500 guests at the hotel that were not able. They couldn't prepare meals there, and so the San Antonio Food Bank prepared 3 meals a day for those 1,500 people for several weeks until the electricity came back on and they had a water supply. But it is a challenge, and I can tell you from speaking to Eric yesterday, it really felt like a gut punch. It was it was hard enough with the pandemic, but having that on top of it really has caused so many people to struggle in Texas.
And then just to add on to that, being part of a state association definitely helps in the pandemic. And I talked a lot about the fact that we all relied upon each other to support each other, especially when COVID came. But there's another layer to that. We're separate from, but a sister organization with Feeding America. And obviously Lisa and all my members are members of Feeding America. And one of the greatest things about being part of that network is that disaster response is a priority in order to be a member. So we as Feeding Pennsylvania have to be involved in our state disaster response. And then we work at a national level with folks who really get on the ground with donors, fellow food banks, and volunteers. I'm sure that this will happen here too. But even back when the hurricanes hit in Texas a few years ago, we had employees from the Greater Pittsburgh Community Food Bank and from Central Pennsylvania Food Bank actually fly to Houston and help run their operations with them. So we really do work together as quite a family to support each other during crises like that.
I want to once again thank Lisa and Jane for being with us today and helping us kick off our Better Health Outcomes speaker series. Your work is so important, and we're so glad to be partnering with you now and in the future. Our next speaker series presentation will take place during Black Maternal Health Week in April, and will be focused on the health crises that so many Black women continue to face when pregnant or right after giving birth. To all who are watching live today and to all who are tuning in on the recorded version, thank you so much for being with us and for your support of Adagio Health. Everybody have a great day and please stay well.